Here's something that might genuinely surprise you. The blood pressure number you got at your last doctor's visit was probably wrong, and not because anyone did anything careless. The setup itself makes an accurate reading almost impossible to get in just a few minutes. I want you to picture this. You get a number that's a little high, you leave the office worried, and maybe a medication conversation starts based on that single reading. Or the opposite happens, a normal number reassures you, and a real problem gets missed entirely. I've watched both scenarios play out with patients, and honestly, it bothers me because the fix is so simple once you know it. Blood pressure is one of the most important numbers in medicine. It predicts your risk of stroke and heart disease better than almost anything else we measure, and yet most people, including plenty of clinics, are measuring it incorrectly without realizing it. So today, I want to walk you through the mistakes that quietly distort this number and exactly how to avoid every one of them. If you want to actually trust the numbers you're seeing at home, go ahead and subscribe now and stay with me through the whole video because a few of these mistakes are ones almost nobody talks about and they can shift your reading more than you'd expect. Let's start with something that sounds almost too simple to matter: a full bladder. When your bladder is full, it activates your body's stress response, the same system responsible for fight or flight, and that tightens your blood vessels and speeds up your heart. Research has shown this alone can raise your top number by as much as 30 points. So the first step, always, is to use the restroom before you measure. Next is a mistake I see constantly, only ever checking one arm. Blood pressure isn't always identical between your left and right arm, and medical guidelines actually recommend checking both arms at your very first measurement. A meaningful difference between arms, more than about 10 points, can sometimes point to a narrowing in one of the blood vessels feeding that arm, which is worth mentioning to your doctor. Practically speaking, you don't need to check both arms every single time, but do it once every few months, and after that, stick with whichever arm reads higher. We're right around the 3-minute mark now, and if these details are already changing how you think about your own readings, I'd really appreciate you hitting subscribe, because the next few mistakes are the ones that quietly affect almost everyone. Body position matters more than people expect. Your feet need to be flat on the floor, uncrossed, and your back needs real support because sitting without back support can inflate your reading by up to 15 points. Your arm matters just as much. It should rest on a flat surface, fully relaxed, with the cuff sitting roughly at heart level. Letting your arm dangle at your side or rest in your lap sounds harmless, but studies show both can noticeably distort the number, sometimes by several points in either direction. Timing is another hidden factor. Your nervous system needs a few minutes to settle after any movement or stress before a reading reflects your true resting blood pressure. So sitting quietly for about 5 minutes beforehand, without talking or checking your phone, makes a real difference. And speaking of timing, caffeine and alcohol both interfere here too. A good rule of thumb is waiting at least half an hour after coffee or tea. Alcohol is a little more complex since it can actually lower your blood pressure for several hours before swinging the other direction and raising it. So if you've had a drink within the past day, keep that context in mind when you look at the number. Now here's the mistake I think causes more inaccurate readings than any other. And we're at the halfway point, so let's slow down for this one. Cuff size. If a cuff is too small for your arm, it takes extra pressure to compress the artery underneath, which artificially inflates your reading. If it's too large, the opposite happens, and you can get a falsely reassuring number that hides a real problem. The fix takes 30 seconds. Wrap a tape measure around your upper arm, halfway between your shoulder and elbow, and use that measurement to choose the right cuff. And always place it directly on bare skin, never over a rolled up sleeve, since that can create a mild tourniquet effect that throws off the reading. If you've stuck with me this far, thank you, and this is a great moment to subscribe because the last 2 points are ones that could genuinely change how you track your numbers going forward. Here's something worth sitting with. Blood pressure isn't a fixed number. It shifts throughout the day based on stress, sleep, activity, and even how you're breathing in that moment. So one reading, whether it worries you or reassures you, doesn't tell the full story. If you're just starting to monitor at home, checking 3 times a day for about 2 weeks, with 2 readings each session about a minute apart, gives you a genuinely useful baseline. After that, most people can taper down to a couple times a week, or even just weekly if things look stable. And finally, a quick note on wrist monitors. Since I know they're increasingly popular, I generally steer my patients toward upper arm cuffs instead. Wrist devices require the sensor to sit precisely over an artery that's genuinely difficult to position consistently, and research following hundreds of participants found the majority had a meaningful measurement error. They're not useless, but I treat them as a backup option rather than your main tool. So here's what I want you to walk away with today. None of this is complicated, and you don't need special equipment beyond a properly fitted cuff. What you need is a few minutes of quiet preparation and consistency, and suddenly the number you're looking at actually reflects reality, which means you and your doctor can make real decisions based on real information instead of a number that was distorted before you even started. If this helped you feel more confident about the numbers you're tracking, I'd love for you to subscribe and join me for the next video, where we'll keep building on exactly this kind of practical, evidence-based understanding together. Take care of yourself, and I'll see you soon.